Melanie, I understand that you've been involved quite centrally in terms of the Shaftesbury campaign, and particularly with a focus on mental health services. We didn't realise today that part of the meeting today was going to consider some of the mental health aspects of the review as well. Did you get an opportunity to put some questions about mental health, or were questions put to the floor around the clinical service review's perspective on mental health?
Questions were submitted beforehand, I understand. They were invited by email. The unfortunate thing was the questions that were submitted weren't put into perspective of who they'd come from. So those questions could have been submitted from anybody. Now, my dubiousness with my nature would be who would submit it. It would have been an idea to say, Mr. T from North Dorset submitted this question, blah, blah, blah. People sitting either side of me were very suspicious on who submitted those questions because they were answered, they were pre-prepared, the answers were pre-prepared.
Was there any frustration at all about the way the meeting was conducted? Because I understand, like you say, there was a gagging order on members of the public. They couldn't speak. They could just sat there. It was almost like the sort of three wise monkeys, wasn't it?
Yeah,
in terms of participation. Was any frustration expressed by members of the public?
Very much so. I heard gasps and lots of comments, people muttering under their breath. The fact that there was no opportunity for members of the public to ask any questions whatsoever was very, very concerning. I looked through the documents that were available, the handouts, and I couldn't see any reference to something that's quite major in terms of backdoor privatisation happening in Dorset, which is the Accountability Care System, or ACS. I understand that Dorset is one of 8, possibly 9 in the whole country that are effectively outsourcing to a private firm the Sustainability and Transformation Plans, STPs, which is quite concerning that they're going to hand over the power of the Sustainability and Transformation Plans, the cuts, the changes, to an outsourcing private company. We don't actually have any reference to that in the accountability, the Accountability Care.
As you know, I mean, there's 2 organisations, one called Virgin Care, who's got its toehold into the GP practices down in Lyme Regis, another one called Integral Holdings over in Poole. Now, they're only looking at the more profitable aspects of the breakup of the NHS into these accountable care systems. In terms of the people that are in there, were there anybody on that board who's likely to benefit financially as executive directors? Was that question put to them, do you know?
Not that I'm aware of, and I myself have put that question to the British Medical Association, along with questions under the integrity of whether the Sustainability and Transformation Plans should be run by, in effect, an outsourcing USA-style insurance company, such as Capita, which is what I believe one of the other STPs is being run by.
Was there, can I just pursue this question? Well, you know, at the beginning, where they're expected to make a declaration of interest, both for themselves, their families and employees, was any declarations made by members of the board about their financial interests in future decisions? Which
was very, very concerning, because as we know, there are a number of MPs in government that have financial interests in private organisations such as G4S and Capita, which would be a conflict of interest. And no, that question wasn't asked, and it wasn't raised at all at the whole meeting.
I mean, that surprises me, because members of this campaign across Dorset put those questions, and also demanded under the Freedom of Information questions along those kind of lines. Who on the board would directly financially benefit from the breakup of the NHS that the STPs and ACOs are proposing? What about, just turning your mind now to the Shaftesbury beds, what was being promised regarding Westminster Memorial Hospital? Because I understand part of the campaign at the Shaftesbury has been to focus on that. You've done a brilliant campaign in terms of getting questionnaires as well as petitions along.
Okay, so in terms of the change, the U-turn really of the beds being kept in the Westminster Memorial Hospital, I see it very much in terms of a stay of execution. They've just said that the beds will stay whilst they look at the long-term future, and they use the word sustainability of the current hospital where it's sited now, and a possibility that there will be another hospital or another community hub, without any reference to additional funding, because obviously you can't build a hospital on thin air, and without any reasoning behind the fact that they believe that the current hospital, Westminster Memorial Hospital, isn't fit for purpose. So just to sort of say we are keeping the beds as they are for the moment isn't really good enough, particularly for the people of North Dorset.
That's interesting, because who's the local MP up there?
Simon Hall.
Yeah, Simon Hall and Drax and Letwin, I understand, are claiming partial victories for these campaigns. Have you seen their presence in this campaign at all?
I can vouch for my MP, Simon Hall, was sitting in front of me. As for the other MPs in Dorset, and the likes of Oliver Letwin and Richard Drax, I did see nobody. I didn't actually see Andrew Morrison, who has been involved in the Save Our Beds campaign, who's the South West Wiltshire MP. I didn't see him there today either.
Because he's also GP as well, isn't he? Yeah. We've had a similar experience in Paul, where there's a person called Robert Sims. He masquerades as an MP, but he's known as the missing person. He's had absolutely no presence during this campaign, even though just under 26,000 people signed a petition. What about the issue, just turning to petitions, what about the 79,000 of us that signed petitions to stop these cuts going through? Was that considered? Because I understand that the research organisation, the questionnaire organisation they got in, had dismissed them as being emotional in relation to that aspect of the overall clinical service review and the return of questionnaires.
There was reference to signatures and the response from the public petitions wise, but there wasn't really much oomph given to that. It was almost like a dismissal. And the fact that they were going to carry on with the options that they'd intended to do in the first place. The fact that they were talking about effectively removing an A&E from Dorset, from 3 A&Es that we've got now down to 2, and the fact that everybody seemed to be in agreement that that was better for patients is actually astounded me, to be honest, including speeches from the guy at South West Ambulances saying that there wasn't going to be an impact on patients. How can there not be an impact on patients by removing an A&E? How can there not be? Absolutely. And we've only got 3 in a whole county. We're now going to have 2.